I'm Jeff Johnson. I'm a periodontist, and I serve as Vice President and Chief Science Officer for Delta Dental, Michigan, Ohio, and Indiana.
I am Mohammed Hamdan. I'm board certified in medical oncology. I practice at Herbert-Herman Cancer Center in Lansing, Michigan. So oral cancer, it referred to the cancer that starts in the mouth from the first frontal part of the tongue and on. And from that line on, that's called oral cancer. However, from that line behind, it's called oropharyngeal cancer.
Highest risk population is the over 55 crowd, although we're seeing an alarming increase in the younger population because of viral infections like human papillomavirus. The incidence overall since 1970s has increased almost 15%. Certainly, tobacco use is a prime risk factor, and smoking is a prime risk factor. And scientific literature seems to indicate that when you put those two risk factors together, it's almost 100-fold increase in risk for the patient.
There's also the cause of alcohol in addition to chewing tobacco. These two risk factors are overwhelmingly seen in the oral cancer. So in general, anything that can increase the damage to the oral cavity or any area in the body, so to speak, especially if it happens repetitively and does not give the body a chance to repair itself, it at some point would probably lead to increased incidence of cancer. For example, people who chew tobacco and they keep the tobacco inside their mouth all the time, and that would cause repetitive damage to the lining of the mouth and would not give the body a chance to repair itself. There is always a chance for those genes that's trying to repair the oral mucosa to go wrong and go into a cancer instead of going to a natural repair. And sometimes before we go to a cancer, we may have a lesion that would be an alarming signs of cancer. I'm not sure how is your experience checking on those lesions which are so to speak pre-cancers.
One of the risk factors we look at are fillings that are causing irritation on the tongue, or an ill-fitting denture where you get a chronic denture sore. We see higher risk of oral cancer in those situations. We look for the first lesion is the white lesion called the leukoplakia, and then if it progresses onto a red lesion, that's certainly cause for alarm.
You're absolutely right. When it comes to an area which comes inside the mouth, which is a thick and white, or a thick and very red, this is the first alarming signs that there might be something wrong, and people need to check themselves into their medical physician or dentist to check that lesion out.
Yeah. In addition to that, if there's symptoms involved with it, such as sudden numbness of the lip or sudden numbness of the tongue, those are usually not good signs. I think first and foremost is that the incidence in younger people is on the rise because of human papillomavirus 16 is being transmitted. There's been an increase in oral sex practices over the years, and because of this, we're seeing a higher incidence in the younger population. That's the bad news. The good news is that HPV-related cancers tend to have a little better prognosis. So even though the incidence of oral cancer is increasing, the survival rates are also increasing. What do you feel about that, Doctor?
I think you're absolutely right. And if we talk about prevention, it's very important for people to know about it before it gets to the advanced area where treatment is needed. So what we advise our population that if you abstain from having oral sex, that will be the first line of prevention. However, for people who really are used to have this practice, precaution will be very important. So you need to know who's your partner. You need to know how to protect yourself before you have oral sex and shortly after. And you need to know what are the signs that you need to watch out for the early cancer or the lesion that pre-cancers.
Yeah. Just to add to that, I think it should be known that we don't have a test for HPV right now. Is that correct?
Yeah, we always check those in the retrograde after we take the biopsy, and then we have a way of checking the presence or absence of the HPV. But we don't have, you're absolutely right, you don't have a way of checking whether the patient can have acquired this infection. The earlier you detect the cancer, the higher the chance that it will be curable. The oral cancer and the oropharyngeal cancer usually goes from local cancer into neighborhood, or what we call local regional. And luckily, it does not spread throughout the body often. So it's most of the time it's either local or in the neighborhood of what we call the local regional. And even in certainly advanced cases, but not spread through the body, we still can cure it. And that's the important point. So when you feel a lump or when you have something in your mouth, you certainly need to go and seek medical attention as early as possible, because that will be your chance to get rid of the cancer and get cured from this cancer. Education. It is very important to bring that to our kids' attention from the elementary school and on. At that level, I know my kids get exposed to sexual education in the elementary school, and I think it should be introduced in that level, how to protect your body, how to protect yourself. Second is educating the family also, and I think it's a good idea to get the family engaged with their kids' education when it comes to their health. Everybody's worried about their kids getting the appropriate education, but we have to have a healthy human for them to, flourish in life. So I think education is very, very important.
And just to add to that, educating them on the importance of regular dental checkups, and to make sure the dentist is looking at these structures, and also when they see the physician, make sure the physician is looking in the mouth as well for these types of things, and feeling around the head and neck area.
So in addition to education, also behavioral changes is very important. Back when the tobacco was accused of causing cancer of the lung, etc., I think there has to be more awareness of how much tobacco can cause damage to the body, including the oral cancer and the oropharyngeal cancer. Changing the behavior of the human is very difficult, but I think starting from early on life to avoid damaging factors such as alcohol and tobacco, chewing tobacco, and educate them about how they practice sex is very important. So the reason why we don't hear much about the oral cancer is directly related to the incidence of this cancer in the population. Unlike lung cancer or the breast cancer, which is very well known in the population and gets everybody's attention, oral cancer is such a small population among the cancers, and that's why we don't much hear about it. So I think it all has to do with how frequent the cancer is and how the behavior of the society is taking care of their body, seeking help when they need. And the most important thing is emphasizing preventative medicine. This is very important.
Unfortunately, it's a very difficult cancer to treat, and the morbidity is high. So even though the incidence is low, the consequences are pretty grave.
Just to add to your points and not to scare people, when the cancer really discovered in a late phase, it really require a team of experts, not one doctor, a team of experts consistent of a surgeon, a dentist, medical oncologist like myself, radiation oncologist, and a general surgeon and a dietitian, and all these team. And we really emphasize what we call the multidisciplinary team approach for these patients. But imagine that with this complexity of decision making geared towards hopefully helping the patients and cure him, versus if you discover that early in the phase of the disease, it requires only a surgeon to take that lump out and then you're all good.
Yeah, plus the reconstruction costs are rather expensive because we have to look at replacing teeth and bones and sometimes cheeks and tongues. It gets very costly.
So what I would say that the golden advice to the population, that if you have an early signs of either thickening in your mouth, changing in the color of your mouth, or having persistent pain, a persistent lump or numbness, always go and see your doctor before it's too advanced and before it's too complicated.
Yes, dentistry is very important because we are very familiar with what normal tissue should look like and what non-normal tissues look like. We're very familiar and are trained very well in detecting these abnormalities, and we are usually well connected with the medical professionals, oral maxillofacial surgery, to get patients care as quickly as possible.
You know, if anything, need to add are two words to remember. One is education. Second is prevention. Education among the student, their families, and the society at large is very important to get their attention to what the risk factors are and how to recognize the early cancers and how to prevent it. So the second thing, if you have anything that abnormal, do not wait. Just do not wait. Yeah. If there is a second message for the population, it will be Hpv vaccination. It is very important that we educate our student, our family, and our community at large that Hpv vaccination is very important, and it will be part of preventing this cancer from happening.